Hello, hello. It is number 2 in my candidate chat series that who knows how long it'll go on, hopefully through November 3rd at least. I'm Laurie Marshall, and I'm running for Justice of the Peace of Washington County in District 3, which is in North Springdale. Bumps up against the Benton County line and takes in most of North Springdale to Thompson, and then over past that is District 4, I believe. So I've set up some candidate chats for a couple times a month until, well, through the summer for sure, to try to just get to know folks in my district or people in Washington County in general who are interested in learning more about the county business and things that are important to folks who live here, and to help introduce them to people in our community who might have services to provide or information that they could benefit from. So I want to start with a couple of little things to share, and then we'll get to our visitor tonight. The first thing is to let you know that county offices have reopened somewhat. I don't have a list of the county offices that are open, but on their website, it says that some offices are open. They're requiring masks and screenings before you go in. But they do encourage you to go to the website and do as much of your business online as you can. You can assess property there. You can actually complete the census through a link on the website. There are also meeting calendars for all of the county meetings that are being held virtually, the quorum court, a lot of committee meetings. I think everything that's being done is being done virtually. So that would be the place. And if you have found it difficult in the past to make it to a quorum court meeting or to take time out to run down and go to a committee meeting, now is the perfect time to be engaging in those, because you don't have to go anywhere. You can sit in your pajamas and watch from home. So I encourage you to get to know your commissioners and your justices of the peace and your judge, the Washington County Judge, Judge Woods, and find out what they're doing for you. So next thing I want to make sure that I let you know about is that there will be 3 testing events coming up for COVID-19 in Northwest Arkansas. The first one is tomorrow from 4 to 8 at NWAC campus in Rogers. I didn't see a location. I assume there will be signs at the road to point you where you need to go, but it didn't have a building name on the announcement I saw. The next one is June 30th, which is next Tuesday, from 7 a.m. to 11 a.m. for you early birds. And that will be at the Washington County Health Unit, and that's in Fayetteville on Wimberley Drive. And then the next one I have down is July 11th, also 7 to 11, also at the Washington County Health Department. Excuse me. I know there's been some confusion about whether or not testing is actually free. The tests apparently are free, but there are people who have been reporting that they are having to pay exam fees, which of course can be very prohibitive to many people in our community. Even if you have insurance, if you don't have an extra $100 to spare, especially if you're out of work, that can be tough. So I would encourage you, if you're finding yourself having trouble with that, going to a clinic or going to the hospital or your regular doctor, to try to make one of these events, and also to let Representative Nicole Clowney is kind of keeping track of that information. She's asked people to let her know if they're having trouble getting tested, if they're being told they don't qualify, or if they can't pay for it, or if there's any kind of barrier at all, to let her know. And she's on Facebook, and she's, I think, keeping track of that so that she can report that back to the governor's office or to the Arkansas Health Department. So that's important information for us to notify them of, so that we can all be making sure that what is being told to us is actually happening, and we are able to get the things that we're being told we're supposed to be getting. Finally, I want to applaud everyone I'm seeing in Springdale this week wearing masks. I am not going out unless I have to pick up groceries, or if there's, thanks Eloise, or if there is some, if I've gotten my order and there's something missing or whatever, I might have to run in and get something. And a couple of weeks ago, it was probably 50-50 to 60-40 seeing masks out and about. And this last week I had to run into the store, and 90% of the people in the Elm Springs Walmart had masks on. And I was really excited to see that. So I appreciate people who are taking this seriously and understanding that this is a moment in time where we do the whole one for all and all for one thing. We come together, and I appreciate it. So also something I saw, I don't remember where I saw this. It must have been on a county, maybe on the health department website. 75% of people tested, yes, at the Arkansas Department of Health units did not report any symptoms when they were tested. So, oh, no, I know where I heard this. Dr. Nate Smith said this in the briefing today with the governor. So he went on to say that those people may have become symptomatic, but when they were tested, they were either completely asymptomatic or they were pre-symptomatic. So this means that 75% of the people who actually end up being diagnosed with COVID-19 in Arkansas are not showing any signs when they get tested and are positive. And so those are the folks that's why we're wearing masks, so that we're not sharing anything when we're not aware that we could be contagious. So, so with all of that about COVID, I want to introduce my guest tonight. Misty Orpin is the woman behind ArkansasCovid.com. I found out about it a few weeks ago, and I've been looking at it several times a week to just kind of keep up with the graphics that she has there are different than the ones that they share in the Arkansas Department of Health. And there's a lot of visuals. So folks who like to see visual representations of the numbers and the demographics and all of the testing information will really appreciate this website. And then there's some other information there too, like there's raw data for people who, like my husband, I'm an artist and a writer. My husband's a math guy and science. And so he loves the data. I love the pictures. So there's something there for both of us. And then there's also a Spanish translation. There's also information about businesses that are requiring masks and doing a lot to keep us safe. So I would encourage you to check her website out. And Misty, thanks for showing up for us today.
Yeah, well, thanks for inviting me. I've always loved you, Laurie, so I appreciate being invited.
Oh, that's fine. I'm going to go through some questions that I've come up with for Misty, just pretty basic ones, really. And then Eloise disappeared, so maybe she just turned off her video. But
no, I'm here. I just turned off my video.
I see it now. There's a little thing at the top. So if there are any questions for Misty after we've gone through mine, then you're welcome to ask them, or any questions for me too, if anybody shows up and wants to ask any questions for me. So first of all, Misty, tell us what spurred you coming up with the idea for ArkansasCovid.com, and what was the goal when you first started putting it together?
So when I first started, I really just wanted there to be a place that tracked the data more visually and tracked change over time at the county level, because at that time the Arkansas Department of Health's dashboard wasn't what it is right now. So they've actually made a lot of improvements to the dashboard, and since I started this, I'm not saying that's because of me, that I'm sure they were finding that all along, but I'm just saying, like, they have made a lot of improvements to it. So when I started, it was very hard to track data. They weren't even giving as many data points to track as they give right now. It was hard to know, like, there was really not any way to know what the change was in your individual county from day to day, unless you had gone ahead and like downloaded the previous day's data and then set up a formula to track that on your own. So I was like, man, most people in Arkansas don't have time to do this. Like, that's crazy. I have a business that was closed because of the pandemic. And so I was like, well, I'll just put my full focus on this and create an easy way for all Arkansans, regardless of their, skill level in Excel or writing formulas. They don't have to do any of that, and just make it available to them. And whether they like the raw data, like you said, or whether they want to see the charts. I found people send me way cooler charts than I'm actually making because they download the raw data and they're smarter than me and they make cooler charts and then they send them to me, and that's my favorite thing.
That's so cool. That sounds like
that was my goal. That was my hope. So like my end goal with it is open access to data. I would love for the state to just be an open data state where they put everything out there for its citizens.
Yeah, just dump it and let people look at it. Open source.
Yeah.
My husband is, with his job, has been working since, probably early March. They pulled him into a team that's been tracking things for his job, and they have to manage, they have to be keeping track of caseloads in different manufacturing areas around the country. And so he is all about that data, but then he's creating charts and whatnot to share with the VPs and all of that. So I totally respect that both sides of all of that. So where do you get your data? Is it all from the Department of Health?
Yeah, I try to only use stuff that's been verified by them. I know there are coroner's reports that have more recent data. I haven't really used a lot of the coroner's reports in the stuff that I create. Sometimes I use it to for ethnicity data just to double check things. One thing that was surprising to me is I decided early on to really get coroner's reports from every county in Arkansas, and I found that it's very imprecise. Like every county kind of does things a little bit differently. It seems like they may not track every case the same. They may not have the same standards for reporting. One I called doesn't even have a computer to track any of that in the first place. I was like, oh my gosh, your county coroner, you have a computer to take care of your data. What is going on here? So I felt like there's a lot of inefficiency from some of the counties, and I just want to be comparing apples to apples. So I felt like the Arkansas Department of Health was the best way for me to do that.
Have you?
They do. Oh, go ahead.
No, go ahead.
They're really good about sending reports on congregate settings, like our nursing homes and our jails and our occupational outbreaks as well. So I get extra reports that are in addition to the database.
Okay, that's awesome. I'm glad that they're being that willing to respond to your requests.
They've been very responsive. Yeah, I found them to be really professional and kind. I will say there's some data points that I think they should be sharing that are crucial to be sharing that they're not sharing. And it's frustrating.
Yeah, but the fact that just a random citizen can say, hey, I have this thing, and they're like, sure, here you go. I mean, that speaks well, I think.
Yeah, well, when I first asked as a citizen, I got a hard no. Then I created Arkansas COVID, and then I started getting
okay, well, once you start saying, look, I'm going to do this thing, and so you can make it easier or harder, or then, Have you, one of the things that I've heard them talk about in the briefings lately is how the numbers change after they'll say, this is what we're reporting, but then we think that number can change. Have you been seeing that happen?
And I'm the reason that they started admitting that it does change. Because I've been tracking the percent positive. So what they're talking about is the percent of all the tests that day that are positive. So if you had 100 tests come back that day and 10 of them are positive, then you have a 10% positive rate for that day. And you want to keep it below 5%. That's what the World Health Organization recommends. The governor always cites a 10% rate, but that's not the World Health Organization standard for that. But I do think it was at one time a CDC standard. It may still be. I haven't checked that in a while. But so the way they calculate the percent positive is not taking the tests that return that day along with all the positive tests they're announcing that day. They take the tests that return that day and the tests that were resulted that day instead of the denominator for that. Where is it, the numerator? Anyway, the percent of positive tests that they're using is only the tests that were resulted on that day. But what we find is, say the governor announced, 687 new cases today. You can bet that a majority of those were tests that the results didn't come in today or yesterday. They came in 3, 4, 5, sometimes like 10 days ago, and they're just now being reported to the state. And so they're just not being announced. Because almost every day, I don't do it every day because it's super time consuming. I get a report from the state that tells me how many cases they have on the resulted days. And I have to go back and retroactively change those numbers to get the new percent positive for 2 weeks ago. And I usually do it a month backwards, and I'll see it increase, sometimes even decrease. Usually like the sooner the date is to now, it's more likely to go up, and the farther it is from now, it's more likely to go down.
Interesting.
It is weird.
Yeah.
It's a really shifty, fuzzy number.
Well, and I knew when I listened to the governor and he says, we've tested this many people today or in the last 24 hours. He does it every time. He says that every time. In the last 24 hours, we've tested 8,000 whatever.
Mm-hmm.
No, that is not, he's not saying that correctly. I mean, even if it is, in the last 24 hours, this many were reported. That's what I'm understanding it to be. Is that correct?
I think a better way to say it would be this many test results came in the
Right.
last 24 hours.
Right.
Yeah.
That's how many have been reported to us in the last 24 hours. Yeah. And he keeps saying it the other way. And I just hit my phone while I'm watching the video. That's not correct. But whatever.
It's hard. Yeah. So I've actually pretty much given up on reporting the state's percent positive. I have it on the data raw data. I have my own where I just take the number they announced that day and the number of new tests that were added to the database in the last 24 hours. And it never matches the state's percent positive, but I feel like it's a more accurate way of tracking it than what they're doing now. I
agree. I mean, it's apples to apples. If it's this many were reported and this many were positive of the ones reported, that's the numbers that we should be seeing. Yeah. Okay. So, so you've said a little bit about what's different between your site and the health department site. Do you have other things specifically that, are there different ways that you're breaking down the data and doing different demographics, or what else is different about their site versus yours?
Yeah, I'd say I just get way more granular with it. You know, like instead of just having the number of hospitalizations and the number of people on a ventilator, I'll be like, okay, here's the number of hospitalizations. Here's a bar graph of how it's changed over time. Here's the new admissions for today. And then over the past few months, here's the rolling, 7-day average of new admissions over the last week or 2 months or whatever. And then I'm like, okay, what percentage of active cases are currently in the hospital? What percentage of the hospitalized are on ventilators? So just really kind of giving you a look at how things are changing over time. And, like, for example, we've got a lot of hospitalizations right now, but the percentage of our active cases that are hospitalized has remained pretty steady over the past month. So it's not that, we have it's not that the virus is more dangerous or it got more deadly all of a sudden. It's just that we have more cases, therefore more people are being hospitalized. And I think that's an important thing to know, like, why are we seeing the increase in hospitalizations? Okay, well, we can know it really just is a factor of population at this point.
Right. Yeah, the more people who have it, the more likely people are going to go to the hospital, which is why in the beginning it was so important for everybody was talking about flattening the curve so that we keep that from being a problem, which I don't know where that went. We don't talk about that anymore.
Hey, they mentioned flattening the curve today, but not in that context.
Oh, yeah. Yeah, he did say something yesterday and the day before about a flattening, and I was like, it was a one-day, whatever. Okay. Okay, so let's see. What kinds of things have been most surprising to you that you've learned as you've been putting this data together, or as watched how it's progressed?
So there are two things. One has been the state's unwillingness to release hospitalization data at a regional or county level. They won't give that information for individual
Only by
hospitals,
state?
or county, or by region. Yeah, they'll only release the aggregated state numbers, which, as you're seeing, it doesn't matter if there are, 57 COVID beds available in Little Rock. If we have 0 available in Northwest Arkansas, I guess we can start transferring patients down there. But I also don't think there's anyway, I'll stop. I'm about to get on my hospital czar kick. I think there should be like a hospital czar or somebody who's like managing all of the hospitalizations and hospital resources around the state to make sure that nobody's getting overwhelmed. There's not that statewide coordination going on right now. It's frustrating. But I think that even the governor said today, he's like, I would like to break that hospitalization down a little bit better by region or county and see what that actually looks like. Well, we would love that too. Like, that would make me feel a lot better if I could see that Washington Regional has, 16 COVID ICU beds available. Like, I'll feel better if I know that. Or not even Washington Regional, just Washington County in general, or Benton County in general. But they're not willing to release that data. So that's been one thing that surprised me.
So I have a question, and this could all be rumor, but I had heard from somebody yesterday who said his wife talked to somebody who talked to somebody who's a nurse who blah, 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 that we're already transporting people to Joplin when they get very sick with COVID in this area, because we're low on being able to treat them here.
So that's exactly why we need the state to release the data, because if we don't know, then we have to go on to rumors, and those rumors are really scary. So give me scary real numbers, or people are going to get their own scary not real numbers. So,
exactly. And so that very well could be a not real number.
Yeah, and I don't know if it is or not either.
But I've been telling everybody.
Wear your mask.
Part of the problem.
People to wear their mask. No, I mean, I don't know that that's not true. I mean, I do know that Washington Regional, I think over the past week, has had to open up another COVID ICU.
Yeah.
But again, that's
but to your point, give me the facts. And let me facts.
I'm not getting that from the state. I'm not getting that from the administration at Washington Regional, because it's just not available.
Yeah.
Thank you.
Yeah.
What was the other thing? I think you had one more thing you were going to say was surprising.
Oh, yeah. I feel like I'm being very critical of the state tonight. I usually try to be really careful. So I hate to say this, but I'm going to have to I'm laying it out there today.
You're telling us what you have been doing to make your site happen and the response that you've gotten. I don't think it's critical to just be like, this is how it's been. So, but I understand your yeah.
I feel like the state has not taken action on the data that is clearly being shown. They've been very slow to actually do things. So like before Washington County exploded, before Benton County exploded, Yale County exploded. Yale County's been having like 50% positive.
Yeah.
For, almost 2 months now, maybe 2 months now, probably closer to six to 7 weeks.
Wow.
And there was never an increase in testing. They're still testing like 50 people a day on a good day. And I expected when those poultry outbreaks started happening and the percent positive skyrocketed, that immediately they'd be doing community testing all the time in Yale County. That we'd be hearing the messaging that there was like a go team, in the Arkansas Department of Health that was on it and that was ready to tackle this issue. 7 weeks later, and nothing. Like Yale County is still not testing. Now we have Washington County that's still not testing. Flabbergasted at that. That's probably been the thing that's been most surprising to me, is their inaction to responding to the actual hot spots in Arkansas.
Mm-hmm. And it feels like they responded here because of the money that we have here and because people have been really vocal. I mean, so it, squeaky wheel and all of that. So, I I've been a little surprised that that we don't have a emergency response team that's kind of on things, or even, you know, our I don't know how this all works, but the National Guard has medical teams, and so, you know, could they not have been put in, or, you know, I don't know.
Yeah.
That's good observation. So based on what you've seen so far and how you see the trends running, and I don't know if you're watching anything around the country or just focused mostly on Arkansas, which I'm sure is enough to keep you busy.
Yeah.
Do you have predictions about how things might go, or where we might be in a few more months?
So I do keep my head so deep in the Arkansas numbers that I'm not good at comparing Arkansas to other places, but I believe in the UAMS models. Like, I know they look really scary, and a lot of people look at that and they're like, okay, hospitalizations are going to increase by like 34 times what they are now. That's not going to happen. But they've been very accurate up to this point. And I don't see us taking any actions to make them not happen right now. So now the rate of growth in Washington and Benton counties is slowing, and that's been the driver for growth over the last month or so. But the testing has also slowed in Washington and Benton County. So it's hard to know, okay, our new cases going down and Washington, not going down. I mean, they're just slightly, you know, the rate of increase has slowed.
Yeah, yeah.
And it's like, is that happening because we're actually testing 9% less this week than we were last week? Or is it something else?
Yeah, it feels like, just looking at the numbers, it's so different every day. It doesn't stay consistent. If we test 6,000 today, then tomorrow it's 2,000. And the fact that it doesn't stay consistent and then the number jumps, it's hard to know.
Yeah, I'm a big fan of week over week data.
And
not really relying too much on day to day, and spending more time on the week to week, I think gives a better look. That's a
good point. That's what we're supposed to do when we're watching our weight. Don't weigh ourselves every day. So maybe that's a good thing to take into.
There you go.
Keep track of COVID-19. Something we all know how to do already. Well,
I have a question. Can I ask a question? Hey, how are you guys?
Good.
I'm still very confused about who should be tested. And I have asked this question a million times and no one has an answer. So like, I haven't been tested. I don't have any reason to think that I've been exposed. And I don't have any symptoms. So I'm like, should I be tested? I'm not being tested because I feel like I would skew the data. You know, do they want people to come out who don't think they have it? Or do they just want to know how many people actually have it in the, you know, the population? Because if you're testing people who don't think they have it, then your numbers are going to look better, right? So do you have any clue about that?
So I think that's a really good question. I think that if people are staying home and they're, you know, only going to the grocery store and they're wearing a mask and they're washing their hands and they're not sick and they haven't been around an exposed person, there's no reason for them to get tested. Like that's not the best use of our testing resources.
Yeah.
But, you know, for people who are at home and they think they have allergies, you know, they're just like, oh, I've got this persistent cough, my throat's a little sore, maybe have a low grade something. Go ahead and get tested if you're in like Benton or Washington County or Sevier County or Yale County or one of these really high % positive counties, because we know that there are infections that are lurking in those counties that are not being diagnosed. So if you have any symptoms, even if they're mild, or if you've been around someone who has tested positive, or, you know, you've not been using good hand hygiene, or you've had to go somewhere with a group of people that maybe you haven't been contacted to know that one of them is positive, but you didn't make good choices in that scenario, which I've been there, where I thought something was going to be a certain way and then it wasn't. And I was like, oh, I need to leave. But if you're in a setting like that, you know, and it might not hurt to go ahead and get tested. But you're right, not everybody needs to get tested just because maybe they live in a high percent positive county. There needs to be some underlying reason. But you know, like you were talking about Dr. Smith saying that 75% of the people tested at the local health units were asymptomatic at the time they were tested. Maybe they were pre-symptomatic and we just didn't know it yet. One of the things that I find interesting about that is children, because I know a lot of the people who are going to the health units are going to be people taking their kids in for vaccinations, right? And kids are more likely to be asymptomatic than older people or, you know, older adults are going to be. So I often wonder if like the youth of the people that they're seeing is kind of skewing that average a little bit.
Yeah. I'm with you, Debbie. We haven't been tested and we've mostly been staying home, and I wear a mask everywhere. I wear a glove when I get gas. I mean, and every time I get back in the car, I'm disinfecting. And so we've wondered if we should. We're with you. We're like, well, even if we have been exposed, none of the three of us that are living in the house has shown any symptoms. So it's probably not worth sitting in the line and taking up the time and the test materials. So
yeah.
And
Oh, go ahead, Debbie.
no, I was just going to say, I mean, I have a cough. You know, I always have a cough. It's probably now allergy related or whatever. And so people are like, well, if you have a cough, go get tested. But I feel like what we should have done is test everybody all at once, because if I go get tested today and I'm negative, then it's, you know, 2 weeks from now, I might be positive. So the people who were tested 2 weeks ago, 2 months ago might have it now, but they think they don't have it because at the time they got tested, they didn't have it. So, and even asymptomatic. So you're asymptomatic, you know, like if you're asymptomatic for a disease, you have that disease, you can pass it on to your heirs, you know, your prodigy, whatever. But asymptomatic for this is like only lasts for 2 weeks. So even if you're asymptomatic, you're only able to infect people for a couple of weeks is my understanding. And then you get over it also, or maybe a month or whatever. And so I just don't think they're doing the testing right. And that bothers me, you know, because then the numbers don't mean what we're saying that they mean.
it definitely seems very reactive instead of proactive. That's too bad. But at this point, there's no catching up with the wagon and jumping back. I mean, it's already gone. So yeah, I think there's so many. Well, and anytime we deal with a population that is varied and has different ideologies and cultures and everything that we have in Northwest Arkansas, there's just no way to get everybody all in the same, all lined up and on the same page with everything. So I think it's up to each of us, like you said, to determine, okay, well, if I feel like I would be wasting time and materials, I'm not going to bother. And I think you can feel okay about that. That's my personal opinion anyway. So,
well, and that might be,
you know, like interact with the public a lot. I'm sorry.
No, I was going to say that might be one reason that our numbers are low in Washington County, because there are people of testing, because there are people like me and Laurie who are just not going in to be tested. That's not that we've had a bad experience or whatever. We just don't think that we should be, or we're questioning, should we go and get tested just for the fun of it? You know, I've had a couple of people say, oh, well, I just thought I'd go. And it's like, I don't know that I want to spend my time that way.
Well, and also there's a risk in that too. I mean, if you look, I get the, I've been getting now, my favorite new report that I haven't released yet, but stay tuned. So, you know, in the press briefing, sometimes Dr. Smith will say like 2% of people who are active infections have been at a restaurant over the past 2 weeks.
Yeah.
So I get those reports now. And the one that's always the highest is doctor's office visits.
Mm.
So more than any other place people have been, they've been to like a doctor or a dentist or something like that. So you are more likely to catch it if you're going into a setting like that. So yeah, if there's no reason for you to get tested, you're potentially putting yourself at risk.
Yeah.
And like you said, you had a cough. So like, you know what's normal for you. Maybe a cough is normal for you. And so you know, okay, this is just my everyday thing. So I don't have to get tested just because I have this.
That's interesting about that, because I have a dental appointment coming up in a couple of weeks. I've been trying to decide whether to go. And I don't know if you guys know Kenton Ross or not, but he is a dentist, and
he's my dentist.
Posted like the places that are safest and not safest. And one of the places that in that article was a dental office is one of the safer places. Now, he didn't write the article, he's a dentist, but it certainly, you know, helped him to put it out there. And when I read that today, I was like, okay, so maybe, but you're saying, at least in Arkansas.
I will say my son's been to the orthodontist 3 times now. He's got braces, and it was a situation where we had to be keeping up with the braces. So we've been to the orthodontist 3 times since they've allowed them to start opening back up. And it's the parents all wait outside. The nurse comes out, you let them know you're there. The nurse comes out and checks his temperature a couple of times. He has to wear a mask in, and they're all masked up. And so I feel like medical clinics are probably, even though the number may be higher for them for transmission or for the contact tracing, they at least are aware of basic control. So
should be doing a good job of it.
We haven't been worried about him going to that. So
yeah, and the number was still like 2 or 3%. Like it's never anything that's
very
big.
funny.
And I don't know what percentage of that is dentists, and then what percentage of that is like you're going to your oncologist, and what percent of that is like your general practice. So who knows?
Yeah. Well, Eloise, do you have any questions? Lingering, lurking?
I do not. I really appreciate this forum, though.
Thanks. I'm glad you came and.
There I am again. Hello.
There you are. Well, I have, let's see, I'm going to post some links on my page for the health department for Arkansas COVID. That was already posted in my post about tonight's chat. And then also the UAMS stuff that you mentioned, Misty, thinking that they were doing a good job of getting information out there. I'll share that. And I also have a call to action that's not related to, well, it is kind of related to COVID. So in November, which is 4 months from now, and we've all been home now for 4 months. So we know that it's gonna fly by, and November is gonna be our election on November 3rd. And one of the things that the governor has been asked several times is how he's gonna come down on the no excuse absentee voting. And he's kind of said things that are a little contradictory, and now he has said that by August 1st he'll make a definitive statement on what Arkansas is going to be allowed to do. But he is waiting to hear from county officials, and what I am concerned about is people who are uncomfortable going out and feel that they are compromised, their health is compromised. Because the Washington County, I don't know Benton County, I didn't have time to look it up today, but Washington County Election Board just recently said that they're not going to require masks of their poll workers or voters. So I'm afraid that that's going to suppress the vote somewhat for people who are concerned about getting out and standing in a line. And even if they do social distancing, you know, there are just those people who be concerned, and
how many polling stations will we have open?
Yeah, and they just may say that's true. I mean, I haven't heard anything about changing the numbers, but
and we're not going to have any poll workers, because those are the retired people who are not going to go.
Yeah, so
we need a recruitment effort for young poll workers to get out there and make it a safer space for everybody.
Yeah,
great idea.
So that's the other thing, Debbie. Thanks for that. If the poll workers don't feel safe, then they're not going to work. And then will we have to close down polling locations because we don't have the workers? So anyway, I feel like August 1st as a time to decide that is pretty late in the game to then have to ramp all of that up. But what I would love for everyone to do in Washington County, to contact Becky Llewellyn, our county clerk, and let her know if it is concerning to you that people won't be required to have a mask. Let her know that you would like for no excuse absentee voting to be approved, so that she can record those responses and get that to the governor. I'm going to share a PDF that I think I've got it scheduled actually for like 7:15 tonight on my page. Greg Letting, one of our Arkansas representatives, has a PDF of all of the county clerks for everybody who is interested in this topic to be able to call their county clerk or email and let them know how they feel. So I'm sharing that so that everybody can go find their county clerk and let them know what your stance is on no excuse absentee voting or not. Everybody has an opinion. But I think it would be beneficial for our state, and it's been approved for the primary. It was approved for the primary, so I can't see why it wouldn't be approved for this. So anyway, that's my action. That's my call to action for tonight. And then to go to my website, look around if you haven't met me before, and read a little bit about why I'm running for office and my background. And there's a donate button, and I would appreciate your support either by sharing my website or donating, however you feel comfortable. So I appreciate you ladies. I don't have anything else to share. Debbie, do you have any announcements you need to make about Washington County politics or anything like that?
No, you're doing a great job.
Oh, okay then. Everybody vote for me. Yay!
Story.
I just need to buy a house in your district.
Yes, you do. There's houses for sale. There's a nice one in the corner, Eloise. So
gotta move.
Well, thanks, ladies. I appreciate your time tonight, and especially
thank you.
I appreciate you so much. I know you had a busy
Misty,
day.
thank you. This was really educational for me. So
Good.
thank you.
I'm glad it was helpful. Thanks for having me out. Laurie, thank you for running for office. That's hard.
Oh, you're
that's
welcome.
Like scrutiny beyond, it just would break me out in hives. So that's very brave of you. Thank you.
A lot of respect for that.
Thanks, ladies. Have a great evening.
Good night.
Bye.
Bye.